What causes a false positive raw blood test? Imagine getting a test result that suggests you might have rheumatoid arthritis when you actually do not. That's what a false positive in blood tests for rheumatoid arthritis can be. These tests look for specific markers like rheumatoid factor and anticyclic citrullinated peptide antibodies. But sometimes, these markers can show up even if you don't have the disease. Several factors can cause this confusion. Rheumatoid factor is an autoantibody that is often elevated in rheumatoid arthritis. However, it can also be present in healthy people, especially older adults. Conditions like Sjogren's syndrome, lupus, scleroderma, and other autoimmune diseases can also raise rheumatoid factor levels. Chronic infections such as hepatitis B and C, tuberculosis, and some viral illnesses may increase rheumatoid factor as well. Certain cancers and lung diseases like sarcoidosis can also cause false positives. Smoking is another factor that can raise rheumatoid factor levels, making false positives more likely. Laboratory differences and testing methods can also influence results. Sometimes, the way tests are performed or the specific kits used can lead to falsely elevated rheumatoid factor levels. Additionally, rheumatoid factor can react with animal antibodies used in some tests, creating interference that doesn't reflect true disease activity. Anticyclic citrullinated peptide antibodies are more specific to rheumatoid arthritis and tend to have fewer false positives. Still, they are not immune to errors. Rarely, infections like tuberculosis or other connective tissue diseases can cause false positive anti-CCP results. When both rheumatoid factor and anti-CCP are positive, the chance of having rheumatoid arthritis is very high. But if only one is positive, doctors need to interpret the results carefully, considering symptoms and other tests. Age also plays a role. As people get older, the likelihood of false positives increases. Certain medications and infections can temporarily raise these antibody levels. That's why doctors always interpret blood test results alongside physical exams, medical history, and imaging studies. Laboratory issues can also contribute. For example, rheumatoid factor can cross-react with animal antibodies used in tests, leading to false signals. In the end, a positive blood test alone doesn't confirm rheumatoid arthritis. It's just one piece of the puzzle. Healthcare providers consider all factors, including symptoms and other diagnostic tools, to make an accurate diagnosis. Testing for both rheumatoid factor and anti-CCP together helps improve accuracy and reduce the chance of misdiagnosis. If you're concerned about your test results, it's always best to discuss them with a rheumatologist who can interpret them in the context of your overall health.